Hello, hello, all my listeners. Welcome to Align with Your Dharma. I welcome you all wholeheartedly. Thank you so much for all your support to my podcast. Um, Today, I have this wonderful individual. As always, I feel like all my guests are unique and excellent, and they contribute to the community in their own way in such an excellent fashion. And so today's guest is unique in her own way and a beautiful individual. And I am glad I got to meet her. And so this individual is board certified by American Board of Primary Podiatric Medicine. Did I say that right?
You did.
And she's also board certified by the American Board of Podiatric Surgery and board certified by the American Board of Podiatric Orthopedics and American Podiatric Medical Specialties Board, diabetic foot care. So she comes with lots of knowledge and wisdom. And she is, let's see, she's a very humble person. And she got her residency from 1992 to 1994. She did her residency, and she's a mentor for American Association of Colleges of Podiatric Medicine. She is a team podiatrist for the Cincinnati Reds from 96 to 2002. And she's also a preceptor for University of Cincinnati for the Geriatric Medicine Fellowship Program. She is a podiatry mentor for Ohio Foot and Ankle Medical Association. She is a past vice president for the Academy of Podiatric Practice Management. So those are some of her professional accolades. And as far as community is concerned, she is an advisory board member for the Lakota East Sports Medicine for the schools. And she is in steering committee, and she's going to tell us what it is about. Liberty Township Comprehensive Plan. She's an ambassador for Westchester Liberty Chamber of Alliance. She's board of directors for the Northern Cincinnati Foundation. She's chairman for the grants committee in Northern Cincinnati Foundation. And she is in the scholarship committee for Northern Cincinnati Foundation. She's board of directors for the Power of the Purse. Whew. Okay, now I can take a breath. She's such a humble individual. And we'll talk more about what it is about the power of purse, so she can shed some light on that. I welcome Dr. Kristin Titko, who is the owner of the Center for Foot Care. And her office is located in Liberty Township in Ohio. Welcome, Dr. Titko. Thank you so much for your time today.
Thank you.
Talking to my listeners. Thank you so much. And I forgot to mention that you are also nominated, like one of the 25 people nominated for Women of Excellence. Is that correct?
That is correct.
Yes. And out of the 25 people nominated, you are one of the 10 selected. Oh my goodness. I'm so happy to hear that. Okay, tell me a little bit more about what is it all about. I know you are a wonderful woman and a humble individual, and your patients all rave about you. And so tell me a little bit about the Women of Excellence.
So the Women of Excellence is an award or an honor given by the Westchester Liberty Chamber Alliance. And they have been doing it for, I think, well, actually, this is their 20th year. And the way the process works is someone in the community nominates a person such as myself. I was nominated by Michelle Moody, and they do this without telling the person who gets nominated. So it's all done behind the scenes. And, Michelle nominated me, and then she went out to the community and got letters of support from others in the community who either feel like I have done something for them, or who have benefited from something I've done, or who are familiar with my involvement in the community. It's really an honor given to people who have made an impact women who have made an impact in the community of Westchester Liberty. And so then there's a selection committee, and the selection committee reads all of these letters of support for each of the nominees. And the selection committee selects somewhere between 8 and 10 people each year. And then that person, if they're selected, such as myself, honored and humbled to be selected for sure, is then notified. And when I got notified, to say I was overwhelmed would be an understatement. I don't know if you've had the opportunity, Aruna, to see my video of me finding out, but all I could do was nothing. I just sat there and teared up, because these women who have been honored in the years past are women that I know who are really, truly amazing women. And my first thought was, there's just no way that, no way. So it is an honor. I'm overwhelmed. The strength of the women, the community of the women, the things that these women have done. I can't even begin to place myself in their grasp, but they keep telling me that I deserve. So I guess I deserve. So I'll go along with it for now.
No, you do deserve, because if you are able to recognize other women who got that award, if you are able to recognize that is in you, that is the reason why you're able to recognize that in other women. So it is a blessing, and it is a blessing, and it is there. They are giving it to you because they see that in you. So yeah, that's what they keep telling me. But I actually nominated this year my friend Jean, and I was so excited when she called me the day before I found out that she was selected. And I was just beside myself with excitement for her. I didn't even know I was nominated, but she found out that she was selected the day before I found out I was selected. And I just could not have been more happy and pleased and excited for her because of all the amazing things that she does. So I truly am honored. There's a gala coming up in a couple of weeks to celebrate it. And I'm going to absorb everything and accept the love and support as best as I know how. Yes. Congratulations again.
Thank you. Thank you very much.
So I want to ask you, to get you started, what drew you to be yourself and offer this to the community, and what drew you to this form of medicine? And then what drew you to start this business? And can you describe your journey until this point, please?
Well, it's been a long journey. Well, I am a podiatrist, and that is a foot and ankle specialist. My father is a podiatrist. And when I was 7, I told my father that I wanted to go to school where he did. So I worked really hard through high school and undergrad to be able to be selected as someone who could attend the College of Podiatric Medicine. It was in Cleveland, Ohio. I went there. That's a 4-year college. I went there, and then I was super blessed and honored to get a 2-year surgical residency. At the time that I graduated from podiatry school, almost all residencies in the country were 1 year long. And so 2 years was very privileged and very unique. And I don't know, I guess I must have impressed somebody somewhere. And I went to Orlando, Florida to do my residency there for 2 years. And it was tough. I'll admit, I called my father twice and told him I'm not going to make it. And he said, well, you don't have a choice. So I was glad I didn't have a choice. I really didn't have a backup plan. So I joined his practice, and we practiced together for 17 years, which was great. That's what I wanted to do when I was growing up. I wanted to work with my dad, and I was right off the bat, that worked out really well. We grew our practice, quickly. And then it got to a point where the practice just got too large. It was so big, and my father's vision was to have the largest podiatry practice in the country. And I suppose we were probably pretty darn close, if not the largest, but it just got too massive, and it was not going the way I thought it should go for my future. And so I went back to school in the middle of working 80 hours a week. I went back to school unbeknownst to anyone except my husband. Even my best friend didn't know, my family didn't know, my father didn't know. I went back to school to get my MBA and decided I would need that if I was going to go out on my own. And so I had a conversation with my dad and went solo. He retired. I, at the time, kept 2 of the offices that we had for myself. One was in Mount Healthy and one was in Orlanger, Kentucky. And it's been 10 years now that I've been on my own, and I love it. It's been full of successes and a couple of stumbling blocks and some very difficult, challenging times. But I truly was raised by my parents to be strong, face a challenge, take a risk, stay focused and believe in myself, which I do. And I started practice. I closed my office in Northern Kentucky 7 or 8 years ago, started my practice in Liberty Township. It grew wildly quickly. I was so honored, so blessed. It was like my first startup office. Of all the offices we had, I'd always had my dad with me. And this was my own. This was, Liberty Township was mine from start. It was me. I was either going to sink or swim, and sinking didn't seem like a good idea. So I was just so excited to be successful in that area that I wanted to start giving back. And I really got to a place in my professional world that I was able to give back. And that's when I started reaching out to different nonprofit organizations, donating funds for needs, and it just felt good. And the more I did it, the better it felt. And that will continue. And that's today.
So when you said nonprofit, the Power of Purse, is this one of the nonprofit?
So the Power of the Purse is actually a ladies' giving circle. And I don't have a full definition for that, but what it means is that we are a group of women. There's 100 of us. Sometimes there's more, sometimes there's less, but our goal is 100. And we each give $100 a year. And that gives us $10,000 that we can, and we do, grant out to a nonprofit organization once a year. And that nonprofit organization would support either women or children. That's how we donate. That's how we've delineated our grant. So we have 4 fundraisers a year. They're super fun. It's always just women. There's wine, there's chatting, there's networking. And of course, there's always a raffle for designer purses. And so we raise additional funds through these fun raffles with these gorgeous purses, and they're very well attended. People love the purses that we get that we can raffle off. And we also once a year do a purse collection throughout the community, and we donate those purses to another organization that helps women called Dress for Success. And yeah. And so we make this huge donation of purses to them once a year. So that is the power of the purse.
Okay, so the that's what I knew about the Dress for Success, but I didn't know the connection between the Power of Purse donation going to the Dress for Success.
Yes. Yes.
So the Dress for Success, tell us a little bit more about from my understanding, I thought it is for underprivileged women who are trying to get into the workforce, who don't have access to like presentable dresses
Correct.
that they can wear, correct?
Yeah. Yeah. So I'm not as aware of their full scope, but I believe that Dress for Success, it does help women who may not have the opportunity or funds or wherewithal to dress. So there are suits, dresses, interview appropriate clothing, a purse, a satchel, and I believe also they do some interviewing skills for the ladies now through Dress for Success.
Okay, so that is one of the nonprofit organizations you support through Power of Purse. Is that correct?
Yeah, so that's one of the organizations that we donate purses to. Now, our $10,000 grant each year, that's given to a different organization. There are different nonprofits who will apply for our grant every year. And then throughout the year, we go through a process of asking the 100 members of the Power of the Purse, who do you want to vote for? We narrow it down through however many organizations apply for the $10,000 grant. We will narrow it down through voting to 3 people, 3 organizations. And then during one of our annual events, the 3 organizations will come in and give a presentation, and then the members of the Power of the Purse do a final vote amongst the 3 finalists to determine who will be getting our grant.
Beautiful. So, is there any stipulations as to who can be part of this Power of Purse Women organization?
No, just have to be a woman.
Yes.
Be a woman who wants to be philanthropic, help support.
Yeah.
We are located in the Westchester Liberty area. It is through that area. So any female who's interested in giving, and again, it's just a strong sisterhood. It's a networking event. It's we've had things like a florist come out and we all make flower arrangements. We're about to do a wine tasting at one of the events, and there's always food and chocolate, which is, I prefer food, chocolate. I'm a big chocolate fan. And then there's those designer purses that we just love. So yeah.
Beautiful. Okay. I always wanted to hear about that when I saw that. And I'm like, okay, I'm glad you are able to shed some light on it.
Yeah.
So let me ask you this. How do you define success? And that definition of success, has it changed over a period of time, evolved?
Well, it's funny that you asked me that today, because just today, my mother and I were out shopping, and she asked me, how do I define myself? Okay. And I was like, I don't know. I'm hardworking. And that's all I could come up with. How do I define success? I think success is finding you're happy.
Oh.
I think, and I don't judge anyone, and I don't like to be judged, but it's easy to do. I understand. Some people find success to be giving. Some prefer monetary things, toys. Some people find just being able to pay bills, raising a successful family, raising successful children. I think there's a lot of different ways to find success. For me, it is finding my happy. What is it that makes me happy? And there's a lot of things that make me happy. And I've been able to achieve, I think, just about all of those. I love to do things. I love to be active. I love to be healthy. I live a very healthy lifestyle. That makes me happy. I am married to the best man that could possibly have walked into my life at the exact right time. He makes me happy every day. I have a practice that's growing. I have a practice that has a positive review online, because that seems to be important. I have a staff that works with me that's wonderful. I have a very stressful life. It's very stressful. I'm busy. I have a lot of responsibility, but I love it. And that helps to me feel successful. I love my life.
That is beautifully said. Wow. I'm like, I haven't heard that definition, finding my happy, but you put it all, you put it all in there, your health and the staff you work with and your family and, how you take care of yourself. It's beautiful. Thank you.
Yeah.
So what is one achievement that you have achieved that you're very proud of as of now?
I think, well, it's hard for me to say that I'm proud of myself, but I would say either finishing podiatry school in a very heavy man-centered world. Just getting through some very weird, uncomfortable, awkward moments during my schooling, my training, and then opening my own practice and it being, I'm not gonna kid you. 2 years ago during COVID, I thought my practice was going under. Like, I was frightened. I'm on my own. I'm solo. I don't have the backing of any hospital system. I've got nobody else to rely on but me. And I've got 8 staff members that are also relying on me. And when people start shutting down and wouldn't come out, and I'm like, this is it. I've worked 24 years to fail. And I think getting through that was surely a challenge. So I guess I could say I'm proud of getting through that. But I think just staying positive through life, whatever challenges come, it's staying positive, it's staying focused, it's looking at the big picture, not letting anybody bring me down. And, I've been brought down for sure. I've been beaten down. I've been beaten down, but it's just, put your pants on and get out there and get up and go. You have to do that because no one else is doing it for you, right? Exactly. So beat me down, try your best, but know that you're not going to keep me there. And that's
there you go.
I'm pretty proud
I
of
like that. Yeah, nobody is going to keep you there. Yes,
nobody's keeping me there. You can put me there for a minute, but I'm not staying there.
Yes. I love it. I love that attitude. Yes. Yay! I'm all fired up. Okay, so since you shared with me the best achievement that you are proud of, and you mentioned briefly about the challenge you had, which everybody did when the pandemic hit. Yes, it shifted everybody's perspective, everybody's life in a different way. But what is the greatest challenge that you have had to overcome? And what did you gain by overcoming it? I mean, the way you are explaining everything, I am like, I'm so honored to talk to you. And I'm sure my listeners would be learning so much from your words. And you're being a great role model. I just want you to know that.
Thank you so much for your kindness. I appreciate that. I think my greatest challenge, boy, there's been so many. I think the greatest challenge that I overcame, leaving my father's practice was really difficult. Really, really difficult. It did not go well. It was time for me to go on my own. And I love my father. I love him. You know, I am who I am today. I am a podiatrist. I am doing what I do, and I am successful in what I do because in great part of my father being a role model for me.
Yeah.
And when it came time for me to leave that practice that we had built together, my father told me that when I went on my own, I was going to fail.
Wow.
And that's a lot, you know, that's a lot for a daughter to hear. And he was very emotional and very passionate about it, that I was going to fail. And he had other people back him up and tell me that I was going to fail. And, you know, whether he said that because he was angry that I was splitting up the practice, or whether he told me that because he knew that would fire me up, I'm not sure. But it was a very difficult time for me. That was probably the lowest. That is the lowest I have been in my life, to have my mentor tell me that I was going to fail.
Yeah.
And then, you know, and then not fail, right? Because no chance that was going to happen then, because you tell me I'm going to fail, and that is not what's going to happen. But he was also someone that I had relied upon all my life, right? So now I didn't have him in my corner for what was going to be a frightening time for me, just going out on my own. And my father did not speak to me for a year. You know, the man that I am who I am because of didn't speak to me for a year. And that was a challenge, Aruna. You talk about like your best, dearest confidant. And it's, you know, it's been 10 years. So I would say at about the third year after it started, I just had to have a talk with him. And I'm like, look, you're my dad. You don't have to love me, but you have to talk to me. This has to be okay, you know, and I'm doing well, and you're happy now in retirement. I'm sure retiring was very scary for him. And that wasn't on his time frame. I pushed him into retirement, and, you know, I'm sure that was very scary. I'd be scared to death of thinking of retiring, you know. I mean, what else am I going to do the rest of my life? But that was a very, very, very dark time in my life. And, we are now 100%, my dad and I, and that is probably, to answer, my greatest challenge overcome, to regain a very wonderful, loving, mutual relationship with my dad again.
So what,
I hardly ever tell that story, by the way. You just pulled that right out of me.
Thank you for being so vulnerable. It's not easy, but I appreciate your vulnerability and sharing that, because, you know, everybody knows you as a wonderful surgeon and, you know, wonderful doctor and caring, but, you know, everybody has something in them that is challenging, and we need to know how they overcome that, because you are a normal individual like everybody else, right? And so would you be able to shed some light on when it was so hard? Yes, who's your mentor? And your dad is the one who motivated you to go to the school and get your degree, and now, you know, he's like completely like letting go, and you have to support yourself, you know, have your mental stability, and it's kind of like you have to show to him, like, okay, I'll show you how I can be successful, and I'm going to show you I'm not going to fail. You know, in a way, literally, it's like proving to him, like, you know, I am your daughter, and I'm going to show you how I'm not going to take this, you know, as a discouragement, but I am going to show you how I can thrive. So when you are doing that, what did you gain by overcoming that? Of course, you got your dad's love back.
Yeah. I think that's probably the best I could ask for right there. You know, the men in my side of the family pass away pretty damn young. And my biggest fear really was his passing away before we reconciled. And he's not a mushy gushy guy. I don't think he's ever told me that he loves me. I don't think that's ever happened. He's told me he's proud of me twice in my entire life. Sad that I can count them, but I can. And so I think that what I gained from that was knowing, again, just knowing that he's either forgotten that he was angry at me, or he's decided he doesn't need to be angry, or he's not as scared maybe of retiring. He's enjoyed his retirement thoroughly, for sure. And so, I gained a lot of strength through that, and I think that's what people should gain from any challenge that they've overcome, is strength, right? More strength. It's probably on the edge of cockiness, right? I think there's a fine line between strength, confidence, cockiness. I've got a pretty strong outer shell. And I think that just helped me to be stronger. So, yeah, like I said, I can be beat down, but I'm not staying there. So
that is a beautiful one. I can be beat down, but I'm not staying there. The quote by Dr. Kristin Titko. Oh my God, that's a good one. I can be beaten down, but I'm not staying there. Okay. So how do you stay motivated?
Well, I stay motivated because I've got staff that I'm responsible for paying. That's a big one. I've got my own bills to pay, but I've got people relying on me to pay their bills, right? And so I wake up every morning knowing that's a heavy load for me. That's a heavy load. I'm not sure they always appreciate it the way that I, as much as it's on my head, I don't think it's on their head, right? They're getting a paycheck. But, and then I stay motivated in life just from being, I'm a truly happy person. This is just naturally me. I've got a great life. I've had fun. I've done all kinds of great fun things that most people in this world don't get the opportunity, or take the opportunity to do, or take the risk to do. I'm married to Mr. Amazing, and that's motivating, right? Every day I want to tell him I love him and tell him how much he means to me. And, I always I'm a fitness freak. So I've always got some race. I'm a runner. I'm an endurance runner. So I've got some race to train for. So that's just setting goals into the future. What do I want to do in the future? Pick a goal, and then you just move forward to whatever that goal is. And you just move. That keeps you moving, right?
Yeah.
If you have something to do, you got to work your way to do it. You can't just say, well, I think I'm going to travel to somewhere next year. You have to have a goal, right? Like, I'm going here, I'm going there, I'm doing this, I'm going to try that.
Beautiful. So I hear a lot of words of gratitude. It sounds like you're very grateful for people you surround yourself, your staff, of course, your husband. And it sounds like you're grateful for your life, and you are a happy person.
I am. I'm very happy. I don't, I've got bad things that happen to me. I'm human. We're all human, right? That's obvious. But, I think having a positive outlook helps. Staying healthy helps you stay positive. Staying involved helps you stay positive. I love my mom till I would lay my life down today for my mom, but she struggles with not being happy and not having goals and not staying focused. And I've seen my grandma on her side, on my mom's side, and I'm like, I'm not that. I'm not, I want to be motivated. I want to be happy. I want to face my challenges and have sad times and hard times, but I want to come out stronger and be thankful for the challenges, right? You can't have great days unless you have crappy days. You got to have crappy days to have great days. I'm just grateful that my great days outnumber my crappy days.
Beautiful, beautiful. I love it. Yes, that is true though. We all have challenges. And it's, everybody has challenges which brings them down. But it's like how we stand up, how we build that courage within us, and stand up back again, right? And if we are boggled down like, oh my goodness, this happened to me, and stay down, it's going to keep us staying down.
Yes.
And it's going to take longer for us to come out of that.
Yes. Yes. The longer you're down, the more you're going to stay there, for sure. So if you have friends, family members to surround you, support you,
yeah,
which is great, but you also have to be that person who supports your friends and your family, right? It can't just be one way. It has to be mutual. You have to be there for them.
Yes. Yes.
Just like they're there for you. It can't just be
yes.
give me, give me, give me, give me. It has to be let me share, let me share, let me share.
Yeah.
Right?
Yeah. Yeah.
And because that feels good too. The more you do for someone else, that feels good. I think for me it does.
Yes. When you give, it gives you so much satisfaction. Yeah, I agree with you.
Yes.
There is so much happiness in giving. It's more, I feel like there's more happiness in giving than receiving. Yes, receiving, of course, is great. Everybody loves to receive, but, there is some kind of a unconditional, there is this unconditional love, and when there is no expectation when you're giving, I don't know, it gives this warm feeling inside.
It does. It does. It does. There was a book I read when I was a little kid called TA for Tots. I don't know what TA stands for, but I will never forget in that book. And it was written for children to read. It was written in like children font. And anyway, it talked about the difference between warm fuzzies and cold pricklies. And I don't remember a whole lot from my childhood. My memories, like, I don't know, there's just a lot in there, I guess, not room for everything, but that's definitely one of my most remembered childhood moments, was understanding the difference between warm fuzzies and cold pricklies, and how the world is better if we share more warm fuzzies and not cold pricklies, right? So everybody can understand that, like, what the heck is a warm fuzzy and a cold prickly? I don't really know, but we know, right? Intuitively, we know what that is.
Yes. Yes.
And I don't know. I remember that book, and it does. It feels good to help others, which is one of the reasons why I do what I do, every day for 10, 12 hours a day. I'm helping people.
Yes.
And I love it. I enjoy when people come in and they're in pain and they leave feeling better. And I feel like sometimes I'm people's psychiatrist or psychologist, or at least their hairdresser, like maybe it's just hairdresser psychology, but people come in and they leave with a smile. They come in, they're hurting, they leave smiling. And I'm not going to lie, that feels good. That feels good to me.
Yes. Yeah.
They're feeling good, but I'm feeling good too.
It sounds like you listen as well.
Oh.
Without any judgment. You listen, and that sets you apart.
It's interesting really that you say that, because in the past 2 weeks, I've heard 3 people say to me, gosh, that other doctor just did not listen to me. And I'm like, well, then how does the doctor know what the problem is? I mean, if you'll listen to a patient long enough, they practically tell you what the problem is. You just have to listen, instead of your own ego getting in there and saying, here's your problem, right? Just give the person 4 minutes to tell you something.
Yes.
And they feel heard, they feel cared about, because they are.
Yes.
Instead of just get in, get out, get in, get out, get in, get out.
Yeah. 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 They already know what the problem is. They just want to be heard and seen and acknowledged. That's all, right?
Yeah.
That's all.
Isn't that what we all want? That's what we all want, right? We want to be seen, heard, acknowledged, appreciated.
Absolutely. Yes.
Simple, basic human desires.
Simple, basic. That is so right. But but most people miss that. And even when they are listening, they're like not actively listening, So it's important, especially as a physician, it's important, right? Because you are in that profession where the empathy and compassion is important. And that's what I noticed, with you, I feel like you're more caring for the individual rather than like, okay, one patient after next, let's get this going.
Yeah.
That's what I noticed about you.
Thank you. Yeah. I feel like, that just seems basic to me. That's what I would want. That's the kind of doctors I seek out, right? If you're not going to let me talk to you, so my favorite doctor of all time is my dentist. I love my dentist. Most people just can't stand the dentist, I guess. I've never even felt that way, but I have had the same dentist since I was 14. And she told me 2 weeks ago that she's retiring. And I thought she just stabbed me in the heart. I'm like, no, right? But she's always been so kind. And I mean, since I was 14, and I already knew I was going to be I already knew what I was going to do for a living. And so I kind of modeled I wanted to, as best as I could, model after she just listens.
Yeah.
Right.
Wow.
Which is hard to do when you're a dentist, because most time they're not talking because their fingers are in the mouth, right? But when you're able to talk, she really listens, and she's just a good friend of mine now, and I definitely can't believe she's retiring on me, but she deserves it for sure.
Wow. I was going to ask you who are your mentors? I know your dad is, but yeah, thank you for saying that. Yeah, that is true though. And I'm glad like you are, the people who you come across in life, you are taking the good qualities in them and you are incorporating it in your life. That is beautiful. That is beautiful. That shows, who you are as a person.
I'll tell you. What you're saying makes me think of my residency years. During my residency, I had 13 male doctors training me. And there was an incident that happened that I was accused of doing something that I did not do. I did not do it. And none of the doctors who were accusing me of doing it could tell me when or where I was when I did it. It was very sketchy. And one of the 13 doctors who had been working with me for a year and a half, one believed me when I said I didn't do what I've been accused of doing.
Mm.
And that man, Dr. Curtis Wagner, I owe so much to him, because all these other docs were fake. They were not genuine. I thought we were all a team. I'm working with them. It was hard enough working with 13 men, no doubt. But, they did not have my back when I thought they were going to have my back. And one guy did. And for sure, Dr. Wagner is one of my mentors. I've talked with him several times since my residency. He's still in Orlando. And as a result, I learned how to treat a resident, right? Because then it was going to be my turn, right? When you start practice, then you're training the next guy. Mm-hmm. And I learned a lot from those men on what to do, how to act, how to treat someone versus how not
to treat.
Right?
Yes.
So you have to learn the good and the bad and decide which are you going to be, which are you going to do, right? So when I started practice and I'm starting to train students, right away, I tried my very best to instill upon them those things that Dr. Wagner instilled upon me, and not the
other people did
attributes of these other people.
Yes, that is beautifully said. That is true though. We learn so much from the people around us. They teach us, how not to act.
Right. They do. Very few people learn.
Very few people teach us how to, be a good role model, because they are being that model. But then, most of them will teach us like, okay, so now I know I'm not going to do that to other person.
Right. Yeah. You have to keep your eyes open and Absolutely. Then decide, who are you going to be like, right?
Yes.
Who are you going to be like? Because you could easily fall over there, right?
Yes.
Or you could fall over here.
Yes.
And you have to decide.
Yes.
Now, I will say that I think that my self-confidence started very early. And I think that helps, right? I think that I had great parents. My mom is a saint. She's a saint, raising me and my brother. But they instilled self-confidence in us. And I think if we could get more kids to feel self-confident about themselves at a super young age, that stays with you. And I think that's one of the keys If I think about like, how did I really get this personality that I have, that I'm so confident in myself that you cannot hold me down?
Yes.
I think it has a lot to do with my very early age bringing up, right? Yeah, I'm grateful to my mother all the time in how she raised us to be confident by making our own mistakes, right? I made a ton of mistakes as a kid growing up, but I had to earn my lashes, right? I had to make mistakes and take responsibility for them.
Yes.
And make mistakes and learn from my mistakes and stand up for my mistakes. And, you know, I tell my mom this, I said, you know, I don't remember ever having a curfew. Like, I don't ever remember having a curfew at all. But I also knew I better never be late getting home, right? I don't know what late was because it wasn't set, but it was that kind of thing, right?
Yes.
When I got in trouble as a kid, I took my punishments and learned from them and tried again the next time in a different way to do something correct. And that helps build a lot of confidence, right? I took martial arts. My mother was great enough to sign me up for martial arts when I was 10. I took that. I think that was huge in learning respect, in learning discipline, and confidence. Because then again, here I am, one girl and a gajillion guys, you know, all in the same dojo, beating each other up, you know, and here's little me. But I learned a lot.
Yes, yes. It takes a lot of grit to, like you said, when it is like men dominated society, and it's like, it takes a lot. And, you know, I am so honored, and I'm sure my listeners are honored to listen as well. And thank you for being, you know, so honest and authentic in sharing this, because this is important. It's good to hear from other successful women who went through those challenges and how they came across, you know, and they are thriving, you know, and without being bitter. It's like, hey, I had challenges, but that does not mean I have to show bitterness towards others. And you are being a perfect example of that. And I was going to say, when you shared about the when you were doing your residency and you were surrounded by these other doctors, when you said you admired this one particular doctor, I remembered this quote somebody mentioned. It's important who you admire, because whoever you admire, you're going to take all their attributes, whether it's good, not so good. So it's important. Right. It's right?
Yeah. Yes. Yes.
It is so important. So I remember that. And then when you said that you are this confident woman, I remembered what Oprah said. She says, people tell me I'm so full of it. And I used to think, why are they saying it? But she says she embraces the fact that she's full of it, because she is, because like, I feel like her, you take care of yourself, you take care of your health, and you are giving back to the community, and you're surrounded by love, and you are giving back love. So you are full of it. And that's the reason behind your confidence. I feel like, you know, you are oozing out that confidence in a beautiful, loving way, and showing to people like, hey, you can choose to be that mean person. And you know, because if somebody was mean to you, you can choose to be like, okay, this person was mean to me, I'm going to be mean to the next person I see. Right. Or you can choose to be, like you said, it's easy to be like that person, or it takes a little bit of effort to be, okay, I'm not going to be that like that mean person. I am going to be this person who cares, who listens to my patients in your situation, right? Yes. It's beautiful. So I was just like, I just wanted to share that with you.
Thank you. I appreciate that very much. You're very kind. Thank you.
You're very welcome. You're very welcome. So what is the best business advice that you have ever received? And if you can share who gave it to you, that would be great.
Well, this is embarrassing. I think the best business advice that I got, I was in practice for about a year. And as I shared, I served a 2-year residency, which was at that time very unusual. I had some of the best training at that time in the country. When I got to Cincinnati and started practicing, I was going around trying to build my practice, talking to primary care doctors and telling them how amazing I was and how I could do this and I could do that surgery and I could turn this foot around and I could make this foot a different size and I could, recreate this foot and I could fix this ankle, whatever. I was extremely confident in myself because I had just had some of the best training available at that time. And I was about a year into practice. I was at a Southern Ohio Academy of Podiatry meeting. So there was maybe 30 of us sitting in a room. And this man came up behind me who I had not met. And he taps me on the shoulder. This is so embarrassing, Aruna. He says, "Are you Kris Titko?" I said, "Yeah." And I said it in such a way like, yeah, the whole world knows me, right? It was horrible. I said, "Yeah." And he said, "Well, my name is Pat Noonan, and I'm here to tell you that you are not the best thing since sliced bread. And if you keep going around telling everybody you are, you're never going to make it in this city." And I looked him straight in the eye and I said, "Whatever." Just like that. I was like, "Whatever." Right? Like a cocky son of a gun. Oh my gosh. And I got home that night and I was mad. I was like, who is he to talk to me like that? Like, I am Kris Titko. I am awesome, right? And then I thought, well, why would he say that to me? Well, why would he say that to me? He would say that to me because he's trying to help me. And I'll bet he's been in practice for a while. He probably knows what's going on around here. And it was that moment that I realized that I better change I better change my attitude. I better change my cockiness and be more sure of myself, confident, and not cocky. And it took me some time, no question. It took me some time to turn that around because it did. It just took me time to turn it around. But that is the best professional advice. And I think he meant it gently, right? But at the moment I was so daggone cocky that I just took it as he was being abrasive or he was threatened or, I don't know what at the moment. But and I told him a couple years later, I said, Pat, I said, you changed my professional world. And I thank you. I thank you. And yeah, that's probably the best professional advice I ever got.
Wow.
Yeah.
And that shows your true personality. Not many people will even mention it, but that shows who you are. That shows how authentic you are and honest you are in sharing it, because that is true, right? There is a fine line, very fine line between being confident and being arrogant.
Yes. Yes.
And it takes another, it takes a special person to admit that, first of all, and it comes with maturity, mental maturity.
For sure. Right. I think I was battling so hard to be confident and cocky during my residency because I was getting so beaten down there, especially in the latter part. I think that I felt like that's what I needed to do to protect myself. And I am very, very indebted to Pat Noonan for setting me straight.
Wow. Well, thank you. Thank you for sharing that. What is the worst business advice you would say?
That's an easy one. The worst, if I might just be pretty crystal clear here, early on in my practice, I was given the opportunity, I had the opportunity to invest in a surgery center. And it was going to be a little bit more money to invest than I comfortably had to give. So I asked my father if he thought it was a good idea. And he said no, because surgery centers were new at that time in this area. And I'm like, oh, okay. And my dad's definitely a very wise businessman. There's no question about that. And so I did not invest. And one of my associates did invest. And some 15 years later, he got somewhere in the realm of $3.1 million for his little tiny investment. And I'm like, wow, that would have been nice. So I think not making the investment that I thought was a good idea, it was, who's to say, right? I could have been out at that time. The investment amount was a little more than I was comfortably able to give, but who's to say I could have just been out, right? What if I would have invested that amount and then would have been out of that, right? If that didn't go well. So, in hindsight, it was bad professional information, but, so be it.
It's easy to yield into the ego and like, okay, I'm going to invest.
Yes.
Yeah.
And I also missed out on an opportunity to invest. A friend of mine owns Skip's Bagel Deli, and he's an amazing, we went to high school together, and he's just an amazing, loving, great man. He's just a wonderful man. And he opened up Skip's Bagel Deli, and I had only been in practice for maybe 2 years. And he asked me for an investment, and I just didn't think I had the money to invest. And he has turned his business into a very successful business. And I missed out on that opportunity to be part of that. So.
So would you say that is one of your regrets?
Ooh, regrets? I don't know if I have too many regrets. I will say I was married once before, my current husband, and never in my life, never did I ever want to get divorced. Never. That was just not. My parents were divorced when I was young, and I think that's disruptive. And of course, you don't want to stay together if you're not in love. But when I got divorced, that was really hard. That was a failure of mine. I'm much happier now, for sure. I'm much happier, and all things happen for a reason. And I believe my higher being has a reason for everything. And I don't regret being married. For sure. I absolutely do not regret being married, my first marriage. But I think that's what comes to my mind when you ask me that question.
Okay. Yeah. I feel like you are a person who, even if you come across challenges, you learn lessons from it and you just move on and you get stronger and stronger.
Yeah. I learned a big lesson there. I learned you have to talk. Surprisingly, I didn't really understand that you actually have to talk to someone for them to know what you're thinking. Isn't that crazy? Like, I didn't know. I didn't know that all of my early years, like, because in my family, especially with my father, there was no talking. It was just all no feelings, no emotion, no anything like that, right? And so here I am marrying someone who's an amazing person, but did I ever tell him what I was thinking or how I was feeling? No, for sure not.
Wow.
And so I learned that for certain. And that plus my husband now, who again is the most amazing, he helps me to talk and share our feelings so that we know how we're feeling and what we're thinking.
Yes.
Right? And that just makes it so much easier.
Yes, that is beautiful. That you shed so much light. There is so much wisdom in what just you shared, because how we grow up as children, how our parents communicate with us, it plays a significant role in our life.
Oh yeah.
Right? So because your dad did not say I love you, or your dad just praised a couple of times so that you can count off, you thought by not saying words, people will understand, what you're trying to say. So that's what you were, doing it in your married life. Wow.
Yeah. Yeah.
And you were learning that, unfortunately, but
all things happen for a reason.
Lesson.
All things happen for a reason.
Yes.
Yes.
Thank you so much for sharing. Like I said, I am learning so much from just talking to you. It's like so many affirmations and just so much wisdom. And I'm sure my listeners would be very happy to listen to this podcast when I publish it. Thank you so much. Okay, so I know you have your routine, but what is your morning routine? So you are so confident and so bubbly, and you're staying so focused, and you're finding your happiness, and you are focused on your goals, and you gain your strength from your challenges. How do you motivate yourself? What is your morning routine?
Well, I would like to say I get to sleep in every morning, but that doesn't happen. I get up at 5 o'clock every day and get to the office by about 6:15. My first patient is at 7:30 or 8, depending upon the day. So I'm one of the rare birds of medicine who actually arrive at the office prior to the first patient arriving. You see, so what that does is it gives me the whole morning. I'm on my own. Nobody else is there. I go through all the charts. I prepare for my day. I know what my day is going to bring. And that helps me to stay on time. That helps my staff with efficiency. And that's just much more peaceful than a complete day of chaos. I just couldn't even imagine what it's like to show up as a doctor an hour after my first patient's scheduled. I mean, how else would you be but mean and rude to your staff and your patients the rest of the day because you're just trying to catch up all day, right? Yeah. That would not work for me. So I show up and I go to work and I have my I eat the same 5 meals every day, practically. And so it's just routine, but I plan ahead and go through my charts, and that helps, again, just the ease of the day. And then on the weekends, I get up, of course, in the morning, go to the gym, and during the week, I'm at the gym or running at night.
Oh, okay. So I was going to say, so you work out in the evening after your work.
Because I'm already up at 5 o'clock, Aruna. That's enough.
Yes.
That's early enough, isn't it?
Yes. So what is your workout routine? Would you mind sharing?
Well, I run 3 to 4 days a week. I train for half marathons and marathons, and I like running on the trail, and I also like running on the road. So, and then I try to go to the gym. I'm not going to the gym often enough. I should go 2 to 3 times a week, but I don't. I try to get there twice a week. Mostly because I also need to do some upper body workout. Like, I'm pretty strong there on the lower extremities, but my upper body, not so much. And I have my grandma's arms, right? That flab under the arm, grandma arms. So, I try to eat clean. I try to eat clean every day. And, I have maybe 1 cup of coffee a day. Gotta have a cup of coffee. I used to not drink coffee. Then you get addicted to that stuff. Woo-wee. Yeah. But 1 cup a day. That's it. That's my limit. So I have that in the morning. Eat clean, live clean. It works.
Oh, wow. I love your energy. Okay. So you shared with us what your typical day and typical morning looks like. Do you have any favorite business tool, resource, any app that you use that has helped you?
No, I'm kind of old school that way. I'm old, of course we have electronic medical records instead of paper charts. I don't think anybody has paper charts anymore, I hope. But, we do a lot of state-of-the-art treatments in the office. We do a lot of laser. We use platelet therapy. We use regenerative cells. We do joint lubrications. We have a microwave energy machine we use for warts. So I like doing very up-to-date, high technique modalities for treatment. I am trained as a surgeon, and I did surgery, a plethora of surgery the first 20 years of my practice. But now I'm learning that there's so many great ways that we can get people better without taking them to the operating room. And their recovery is stronger, their recovery is quicker, there's less downtime. We used to have surgery used to be our only option to treat an ankle sprain or a ligament rupture or a tendon rupture or arthritis. We would only address it surgically because that's what we knew to do. But now with all the biologics that are available with platelets and stem cells and joint lubrication and hyaluronic acid, and now we even have a fat pad replacement for people. So we can take someone who's maybe a person over the age of 50, say, or someone who prefers to wear high heels that push the ball of their foot into the ground. We can actually put a fat pad replacement in when the ball of their foot, they've lost their fat pad from pressure or time or age. It's amazing. I mean, there's just so many up-to-date things and new technologies available in my world as a foot and ankle specialist that rarely do I do surgery anymore. There's definitely still a place for surgery, but the recovery time, the success rates, the decreased complication rates that we have with all these new technologies is amazing. It's simply amazing to me. I love it. And I love learning new things. I might be older, but I love learning new things that help my patients get better, quicker, stronger, less time from work.
Yes.
Less complications. It's very fulfilling to me to see success for my patients. You know, I do have an ego. I mean, I know you think I'm all kind and wonderful, and I appreciate that, but I do have an ego. So I like to be successful, and success for me is also success for my patients, right?
Absolutely. But you are putting the patient's recovery first, and how I feel like your thought process is like, how can I make my patients recover faster without the surgery if possible?
Yes.
Yeah.
Oh, yes, absolutely. I mean, if I used to tell someone they'd have to take 12 weeks off of work in order to fix, I don't know, a tendon tear, tendinopathy, tendinitis, a sports injury, 12 weeks off of work, imagine not getting paid for 3 months.
Yeah.
Or even if you're on short-term disability, you're not making as much. So if I can turn that around and get them back to work the next day or the next week,
wow,
that's a huge benefit.
Absolutely.
To them, right?
Yeah. Yeah.
So yeah, and I'm once a year there's a seminar that I go to that learns specifically about, okay, well, how do we help these people get better quicker, and what's new technology? And of course, I have to invest in that new technology, right? I mean, a laser is not cheap. So I have to invest in that, but okay, let's do that for the better good of let's bite off a little bit more to get people better, quicker, stronger, faster. I mean, to me, that just makes sense. To me, that's just keeping the patient's best interest in mind. That's what I need to do.
Absolutely. Wow. Well said. So what is next for you? What do you see next? I know you said you want to go attend seminars and learn the new things.
Yeah.
But what is next?
Well, there has to be something, doesn't there? There does need to be something. Let's see. I would like to see myself. I don't want to retire yet. I'm having a great time doing what I'm doing. But I do have 2 really amazing podiatrists that have shadowed me over the past few years that I'd like to help them further and further. And I think they might have some interest in joining my practice someday. So I'd like to, from a professional standpoint, I'd like to help them if they would be so kind as to take my help. From a personal standpoint, I just want to keep being healthy, staying focused on my health, staying focused on my marriage, staying focused on my family. And, you know, I don't know yet what that looks like, but I think it's going to be more traveling. I feel more traveling coming up. I love to travel. I love to eat. Yeah, those are my 2 big things, traveling and eating.
That's beautiful. So, you mentioned, somebody who has had tendinopathy or tendinitis, but what other common ailments that you see that your patients come to you? And you already mentioned that you are looking to get them sooner, recover faster, so they can get back to whatever work they're doing. But what do you see common in your office?
Probably the most common thing I see is heel pain. So
Ah,
people who have heel pain, they will frequently call it heel spurs or plantar fasciitis. There's actually more appropriate terminology that's boring at the moment. But heel pain, pain in the ball of the foot, calluses, sports injuries, sprains, strains, tendinitis. I do a lot of treatments for diabetics. People who have diabetes will either have wounds on their feet, or they will have nerve damage where they can't feel their feet go numb. We actually have a treatment that reverses that nerve damage, which is amazing. They start
wow.
walking better, they feel better, they sleep better. So, you know, there's really weird, bizarre things that we see also, but those are probably some of the more common things that we treat. Yes.
And so those people who have nerve damage, and you said you have seen them be successful, you know, recovering from that. How long does it take after your treatment? How long does it take for them to gain that, you know, nerve to regenerate?
So it depends on how bad their nerve damage is and when they decide to start treatment. So the general thought process for most people is, well, it's not that bad yet.
Yes.
Let me let my nerve damage get really bad.
Yes.
Then you treat it. No, I'm not a miracle worker. I'm just a medical person. So the most successful treatment in preventing or reversing nerve damage is when we catch it early.
Yeah.
And so if we can catch early nerve damage in someone who has diabetic neuropathy or alcoholic neuropathy or B vitamin deficiency neuropathy, if we catch that early when they just start to have numbness or tingling in their toes, they're back to feeling full sensation, usually within about 5 weeks.
Wow.
Yes. You know, and that means that they can walk stronger. They're not stumbling. People who can't feel their feet, they stumble, they fall, you know, it's dangerous for them.
Yes.
Yes, it's painful, but you know, waiting until you're numb to your knees, I can't help that, you know, but I want to help you in the early stages and be successful, getting you where you want to be.
Wow. I do want to ask you, how do you unwind, and what do you do to recharge?
Well, I think I wind down. If I can take a run or go to the gym after work, that helps me a lot. I like red wine, so that helps a little. And truly, from the depths of my heart, the way I unwind the best is just cuddling up with my husband.
Oh.
We cuddle, we watch TV, we just sit and talk, or we don't talk. Being next to my husband is the most calming, loving feeling that every person in this world should be allowed to feel.
Oh, that's so sweet. That is so sweet.
It's true. How do I rev up? Just get up. You know, I'm blessed to be. I am blessed to wake up every morning, right? Like, aren't we blessed every day we wake up? Because not everybody gets that. Not everybody gets to wake up.
Yes. Even though we go to sleep thinking like, okay, we are going to get up. Nobody's promised that next morning.
No.
Yes. Thank you for mentioning that.
Yeah. I think that just some days are easier to get out of bed than others, right? But so far, knock on wood, every morning I wake up. And that really does. That's good. You know, yeah. I just ran a race last weekend, the Marine Corps Marathon, and at mile 20, there was a gentleman receiving CPR. He had had a heart attack, and that was really hard to see. Yeah. Really hard. Like, not just because you're trying to run 6 more miles after running 20, but you're like, oh my gosh, this man's not going to make it. And I just saw him getting chest compressions, and that's not good, right? And so my whole mind for the rest of the race and the rest of the day was, what's his family doing at the finish line? You know, they're waiting for him. How long does it take for them to learn that he's not coming in? Or, you know, how does that, how does that change the every aspect of his world and everyone that he's touched, right? I did find out subsequently that he survived.
Oh, good.
And yes, it took me 3 days to learn that. But, that's again, you don't know what tomorrow brings for you. You just don't know. So I believe you should be grateful, thankful for everything that you have.
Wow. You're just a wonderful, wonderful individual. I'm grateful for talking to you. Okay, any question did I not ask that you wish I had asked?
I don't think so. I would like to put a big old shout out to my husband, Tom. He is my lifesaver. He has saved my life 3 times. Once he saved my life from an emotional standpoint, and once he saved my life from a very dark space, and he has also helped me save my life financially. So he is a partner that I believe that if the whole world was in love the way I am with my husband, the world would be a better place.
Wow.
So I want to put a shout out to my husband, Tom Stanforth. He is amazing. And no, he can't hear me right now. I'm just saying it because I feel it.
That is beautiful. That is so beautiful. Okay. I'm going to put your Facebook page so people can connect you there as well. And then your LinkedIn page, is that a good one for you, for people to connect with you?
Probably.
Okay.
I don't use LinkedIn a lot because I'm not usually looking for a job.
Okay. Okay.
But there's definitely a lot of people on my LinkedIn page for sure.
Okay. So Facebook page would be a great place for people to reach out to you?
I think so, yes.
Yeah.
On my website, if there's a way to put it on my business website, that'd be great.
Okay, perfect. Okay, Center for Food Care.
Yes.
Yes. Okay. Thank you so much. I
Marina, thank you.
Appreciate your time for on this day, on a weekend, to take your time to talk with me. I learned so much, and I truly mean it from the bottom of my heart. And you are being such an inspiration for all women. And the way you explained how you survived when there is a group of men there, and you as an individual woman, you showed the world how to survive and thrive being a businesswoman. And at the same time, I also realized when you said that Dr. Pat came and told you how to change the attitude, you took it, and you did not let your ego come in the middle. And that says a lot about who you are. Instead of just like, you are humble and a confident woman, balanced.
Thank you.
So
thank you.
That's how I feel. And thank you so much for your time.
Appreciate you very much.